Hi everyone, and welcome back to my channel. My name is Tanisha. I'm also known as ER Nurse 86 on Twitter for those of you who don't know me. Today's video is going to be about the coronavirus. I'll talk briefly about the history of the virus, how it spreads, signs and symptoms to watch for that could indicate possible infection, different things that you can do to protect yourself and help prevent the spread of the virus, and I'll be debunking a few of the rumors that I've seen spreading across social media regarding the coronavirus. So what exactly is the coronavirus? Well, it's a family of viruses that are known to cause upper respiratory infections in both humans and animals, and it was first discovered back in the 1960s. Over the last 20 years, we've had three major health crises revolving around different strains of the coronavirus, with COVID-19 being the most recent one. The first outbreak that comes to mind is SARS, known as the Severe Acute Respiratory Syndrome, and the first case of that virus was actually reported in April of 2003 in southern China. The next virus that comes to mind is the MERS, Middle Eastern Respiratory Syndrome virus, and that one was first reported in April of 2013 in Saudi Arabia. Now, the current virus, COVID-19, was originally reported in early December 2019 in Wuhan province, China, and since then it's spread across the world. So, how exactly does the coronavirus spread? Well, according to the CDC, it's spread by droplets, meaning people who are infected with the coronavirus expirate droplets containing virus in when they sneeze or when they cough, and those droplets can land in the noses and mouths of uninfected people and cause them to become ill. It's also possible for people who are infected to sneeze or cough and expirate droplets onto different surfaces, thereby contaminating them as well. So if you touch something that has been coughed on or sneezed on by somebody who has the coronavirus, it's possible for you to contract the virus that way. So what are the signs and symptoms of coronavirus infection? Well, they're very similar to other upper respiratory illnesses, so they include things like fever, any sort of respiratory distress, including wheezing or coughing, or if you are experiencing congestion, runny nose, that sort of thing. If you have any of those symptoms, I highly advise for you to go in and see your primary care provider, and if you're not able to do that, get into the emergency room so that you can be evaluated by a physician. So how can you prevent spreading the illness? Well, the biggest thing is going to be hand hygiene, and I'll go into more details about that in just a moment. The CDC is also recommending that you avoid close contact with any people who might be sick. They advise that you stay home if you yourself are sick. Make sure that if you're coughing or sneezing, you cover your mouth with a tissue, and if you're going to do it directly into your hands, make sure that you immediately wash your hands afterwards and don't touch your face or anyone else until you've done so. If you're sick, the CDC recommends that you wear a face mask. Now, a face mask is not going to do much for anyone who's not sick and is wearing one to try and prevent themselves from catching the disease. Your average run-of-the-mill hospital face mask does not provide adequate protection against droplets, but it will prevent the spread of the droplets from someone who's already sick. The only type of mask that will protect people from inhaling droplets is an N95 mask, which is a specially created mask for hospital workers and in other healthcare providers. And you have to be specially fit tested for that mask to even perform properly. So I highly advise against it. Masks are going to be most effective if used by people who are already sick. The CDC also recommends that you clean and disinfect frequently touched surfaces daily. So things like tables, doorknobs, light switches, countertops, sinks, handles, desks, phones, keyboards, that sort of thing. Make sure that you're cleaning those surfaces daily, and use detergent or soap and water prior to performing your disinfection. So, hand washing. In order to perform good hand hygiene, you're going to want to make sure that you're using a good soap, make sure that you're using hot water, and you're going to want to wash your hands for a minimum of 20 seconds. Now, once you get your hands wet, you're going to want to put soap on your hands and get up a good lather. Make sure that you're washing in between your fingers, in and around and under all of your fingernails. And make sure that you rinse your hands thoroughly before you dry them. Now, hand sanitizer is a perfectly good alternative if you do not have soap and water readily available. But keep in mind, if you're using hand sanitizer, it will not be effective if your hands are visibly soiled or if they're greasy or anything like that is on your hands. If you have anything like that on your hands, you're going to need to make sure you use soap and water. If you're using hand sanitizer, make sure that you're using hand sanitizer that has at least 60% alcohol in it, and it must be alcohol based. Now, hand sanitizer is not going to kill all bacteria or viruses, but it will kill most of them. So if you're going to use hand sanitizer, make sure that you're using it properly. So different rumors that I've seen regarding the coronavirus online include a viral tweet that I saw where someone said that if you are not sure if you are sick with the coronavirus, go in to donate blood and they'll be required to test you for free in order to clear you for a blood donation. This is incredibly dangerous. It's selfish, it's stupid, it's a waste of time, and it's patently false. We do not test for coronavirus through the blood. Coronavirus is tested via a respiratory sample, meaning we take a sputum specimen or a nasal swab or an oral swab and send it to the lab. Blood work would be done to check for other things like possible infection to make sure that you're not septic, but we do not check the blood for the coronavirus. Another rumor that I saw going around social media is that hand sanitizer just spreads around bacteria, and that's not true either. Hand sanitizer has been proven to kill at least 90% of germs, and that's as long as you are using hand sanitizer that's 60% alcohol, like I mentioned before. If you guys have any questions regarding the coronavirus, please ask them down below. I'll be ready and available to answer your questions. If you have any comments or concerns, please leave those down below as well. Thank you guys so much for watching this video. The next one, I will be getting to that ER story time that I mentioned in my last video. I just felt that it was really important to discuss the coronavirus because it is such a current issue, and a lot of people are very rightfully concerned about this illness. So thank you guys all again for watching, and I'll see you in the next video. Bye.